firstly, it's very important to understand that there's sort of a various aspects of the tissue engineered organs that have been developed in the last 20 years, really. One is, of course, regards the cells. And when we talk about the cells, for simple tissue, probably somatic cells will still be important to develop those to clinic because they have the advantage they can be used in an autologous way, which make them safer by definition because you don't have to immunosuppress to use that type of tissue. And secondly, costs will be lower. But they're more complex organs, such all the heart, the kidney, the liver, and the lung that will require more to cell from a pluripotent cells, either reprogrammed cells, and people have been talking about taking lines that would be more acceptable among different individuals, so try to make them not visible by the immune system, but those techniques may become a bit dangerous for these organs once they're implanted. And the other possibility is to take it from a more embryonic stem cells, for example. And the community has become very good on differentiating them towards specialized tissue. And those protocols are becoming very robust. In some of the lineages, this works very well. And therefore, it's closer to the clinical application. We think about neuro, for example. The problem there is that you will have to use immunosuppression, and there's a potential, of cost being high, particularly if you want to use an autologous setting. So if you are thinking about building an organ for an individual, starting from his or her somatic cells, getting those somatic cells expanded, and then creating IPS from those cells and differentiating the organ, this is going to be very costly. So this is where we are still standing on the debate between the different cell types that can be used for building organs, for regenerating tissue and organs. The other aspect is the polymers. So polymers are being really developed with smart polymers. So polymers that can help differentiating cells, that can help maintaining the niche of the cells, and help functionalizing the cells in a way that will be useful for the organs to function once implanted. But the scale up to reach human size is still very difficult. And so therefore, deserialization, so stripping out the cells from organs that can be transplanted and then seeding the patient own cells, so patient derived from iPS cells, that's still a technique that I think would be useful. Interestingly, there's been hybrid that has been developed using this type of technology that has been developed in regenerative medicine that probably will see the light in patient much sooner than any engineered organs. Ludovic Vallier group from Cambridge, for example, has developed this technique of sort of regenerating liver for transplantation. So liver that are being discarded from transplantation are being able to be regenerated in a way using stem cell technology. So they use biliary organoids, so biliary stem cells injected in these organs that were discarded, in human organs, in an in vitro system, which is already a clinical grade. And they show that these cells can integrate and can rescue partially those organs. So, this technology, we have to imagine that these organs that will be implanted in patient may actually be a hybrid between what we know already and what is already surgically acceptable and what is the advancement of technology. So it may be very different to what we think now, but it may still imply a lot of the technology that we've been using.